Good morning. This is Faith in Our Hometown, brought to you as a community service of Mercy Hospital, Joplin. And now, here's your host, Father Jay Friedel.
Good morning. My name is Father Jay Friedel. Welcome back, or welcome to Faith in Our Hometown. Our discussion with other people of faith about issues surrounding life as we know it here in the Greater Joplin area. This morning we're going to be talking a little bit about the poor once again, and what is our role toward the poor, and whose job is it to take care of the poor? How would we approach some of those things? Because while I think we can agree that it is certainly the role of a faith community, especially Christian communities, Jesus said, you know, the poor you'll always have with you, and he gave us some instructions for trying to take care of them. But we're also with James Whitford, who is the Executive Director of Water Gardens, the Gospel Rescue Mission. We're going to be talking about that and the role of government this morning as we come back, and we will be right back right after this Mercy Minute.
Hi, I'm Angie Separito with Mercy Hospital. I'm here today with Dr. Lance Borup. Dr. Borup, you are a breast imaging radiologist, correct?
Correct.
And we're going to talk about 3D mammography. Can you tell me about that?
Yeah, 3D mammography is a new technology that was just passed by the FDA in 2014. And what it does over 2D is it allows us to see the breast tissue in slices as opposed to overlapping tissue. And that allows us to see the breast cancers sooner and smaller, which is a better result surgically for the patient. Also, it allows us to call back patients at a lower rate as well. We're finding we're only calling back about a third less of the patients than before.
So quicker results, and you can get them in and see things a lot clearer. So it seems like a no-brainer. That's what you want to do.
Absolutely.
Perfect. If you want to find out more, you can call the number on your screen or visit mercy.net.
Hi, and welcome back. I'm here with James Whitford of Water Gardens, and James and I are talking a little bit this morning about, the poverty, the poor. Jesus said we'd always have them with us, and we've certainly in our work encountered them here in the city of Joplin. For those who aren't familiar with some of the work that you do, why don't you just give us a brief overview of Water Gardens?
Well, sure. It's a gospel rescue mission and has an emergency night shelter. We shelter men and women. We have a day outreach program where we meet needs of the poor, not just in the Joplin area but throughout. But we certainly believe that the primary role belongs to the church, and so we have thousands of volunteer shifts that get filled in a year from local Christians coming to serve.
Right. I know some of our own people at St. Peter's come over and volunteer, cooking breakfast, one morning, and those kinds of things. And we, of course, at St. Peter's, we run, basically in the old language would have been known as a soup kitchen, known as our outreach house, and we feed folks, 3 days a week, trying to make sure that everybody in the area gets fed, because that's one of those things that we just, food is a basic human right. We think, everybody deserves a right to be fed, and so we're both heavily involved with folks in the area. We too have lots of volunteers who come and do those things. We receive, donations from our own parishioners, from other people who are interested. So people are there out feeding the poor, and you're working with, you're even sheltering them overnight, those who are homeless.
Yes.
So in terms of that, you started by saying, do we believe that this is the role of the churches? Would you talk about that a little bit?
Yeah, well, sure. But Father Jay, I want to go back to something you just said about food being a right. So I think there's a lot of debate about that issue, whether or not food is actually a human right. Food is certainly a need. But one of the things that we find is when we reflexively respond to the need that we see, whether it's a person without clothes who needs clothes, or if it's a person who's hungry who needs food, there's a guttural compassion that rises up in us to want to feed and to want to clothe. But we've got to really ask ourselves the question, what happens when we do that over and over and over again? And so what we found, and I think what most people see is true, is that repetitive need meeting like that can result in dependency, where people kind of end up almost in a bondage or dependent upon someone else rather than maybe pursuing a route of self-reliance, which is something that we work very hard at our mission. So
sure, and I would agree with you that some people become dependent on the system. All right, I've seen that certainly in my work. I've also seen some people who'll game the system, who will go to this place on this day and they notice nobody's watching, or before we were using Charity Tracker and those things together, they'd go one place on Monday, then we'd go to another place on Tuesday, and they'd make it their it actually became their work, was to try
Right.
to see how many different places they could hit. And yes, those people do exist. And I'm all about trying to make sure that we limit their access, all right? But I would also say that I would be very careful in my own life, because I have been blessed. I've also worked with folks long enough to know that there are a lot of people out there who, for whatever reason, can't seem to put all the pieces together all the time, who do start to fall through the cracks. And I would just caution us a little bit about making sure that I don't develop what I would call, doing social service work on the hard edge of things, so that I'm always suspicious of everybody who comes to the door, always suspicious of everybody who comes for help. I'm going to give most people the benefit of the doubt. Now, when I work with them for a while, and then I start trying to help them into the next level,
Right.
that's when I build up a relationship that's good enough with them that then I can challenge them
Sure.
to maybe do a little bit more.
Sure.
That's when we can challenge them to say, okay, well, you seem to be needing this all the time. Especially in terms of when we were giving out food baskets and things like that. And we'd say, well, if you've got to come more than 2 months in a row, well, we want to get you into case management. We want to get you into a spot where you don't just have to come to the food, but you can be making enough of a difference in your life that you're not caught always having to come to us for food, so that you can do those things.
Yeah, and so I think in my opinion, you're pointing out the importance of the relationship development.
Oh, yeah.
I mean, not only is it good for the soul, but it gives you information about how to better help that individual.
Right.
And so, and just talking about, I think you introduced the segment as just, the role of the church and the role of the state. And one of the things that we found is that the more that the state gets involved in helping people, it seems to disconnect the relational factor that can occur at a local community level. So
Right.
I no longer need to do case management maybe with Father Jay. I can just go over here and get what it is that I need. And when,
Right.
when we start to break away those community relationships that can be developed like that, I think we really begin to hurt society.
Well, and I think that there's a propensity both on the part of the church and society, and I want to talk about what society's role is in a minute here too. But I think there's a propensity on the role of the church and society to want to. I think there's something there that's inherent that we would want to help. Okay.
Oh yes.
I do think that sometimes by helping too much or not gently prodding people to do more, we sometimes can make them dependent.
Yes.
And I agree with you that that is a problem. And I would certainly not want to feed into that. But I think that in our given society today, we're kind of tipping over to a different attitude. And that attitude is that everybody is on the dole, or everybody's trying to take advantage, or everybody's trying to do those things. And I really caution some of my folks when they start talking that way to be careful, because many of them have never walked in the steps of some of those people that are in some of these situations. When you work in the situations like you have and like I have, you know that in this situation, this person had a full-time job and everything was going well, and then all of a sudden, but they were living paycheck to paycheck, and then one thing happened that threw the whole thing out of whack.
Or maybe things have never gone well.
Right.
I mean, I see that more often than the other, I think.
Well, and sometimes again, cautioning people that sometimes the ability to keep your act together is a blessing. It's a gift. And not everybody's given that gift in the same amount.
Right.
And I've got to stop being so judgmental when my brother or my sister can't keep their act together so well. I've got to not develop that hard edge that says, well, you're just not working hard enough, or you're just not trying hard enough, or you're not doing enough for yourself. When sometimes, to use the old saying, but for the grace of God,
right,
there or you would go ourselves in that same situation.
Yeah. Sometimes I think we consider let's say the requirement for work, for something that you need in exchange for something that you need, as almost a form of judgment, like you ought to just go ahead and pull yourself up by your bootstraps and go out and get it done. But the truth is work is a very dignifying experience.
Yes, it is.
We think that work awakens worth in people, and there really is a way to see people with a compassionate eye, to really care for them, to really love them, and also ask them to participate in earning what they need. And at the same time, really restoring a sense of dignity, or at least esteeming human dignity through work like that. Now, so it can be done in a very compassionate way, I believe, but it can also be done in a very finger-pointing type of way, which is what you were talking about.
Yeah, and that's what I think we got to get away from, because I agree with you wholeheartedly. With some of the folks that come to our outreach, some of them will, offer to wash dishes, or they've offered to help clean the table, or they'll help clean up the table for somebody else. Or, somebody will come out with a rag and start to wipe, and they say, oh, no, here, I'll take care of that. And they'll start doing it. Again, now those are little things, okay? Those are little things. But I also look at some of the folks who sometimes come to be fed, and your whole point about saying, that's one of the reasons why we changed our complete philosophy at the Outreach House a few years ago. Now we serve lunch. All we ask is anybody's name. That's all we ever ask. We don't ask, why are you here for lunch? We don't ask, why do you need lunch? We don't ask any of it anymore. Simply, we just say, we're open for lunch. If anybody wants to come by and have lunch with us, have lunch with your neighbors, come by and have lunch with us. So you can show up. You can just show up, and if you need lunch on Monday, Wednesday, or Friday, come on by.
I might.
Because, come on. We'll do it. We'll have a good time. Because, and that's why we changed the philosophy, because we wanted to get out of that business of having to, figure out where somebody met the condition for whether or not they, quote, needed lunch on a given day. Now, I don't want to do that with all of our resources, and, if somebody's going to come and say, I need, help with this, that, or the other thing, well, then we got to investigate a little bit more and say, okay, well, how do we get in this spot? Are we throwing money down a hole? Or, how do we do some of those things? And that's when the deeper business of case management starts. But that, we all refer to our Catholic Charities office here in Joplin.
Right.
Because that's where, those are trained social workers. Those are people who are trained to do that kind of good stuff. And that's who I want doing the case management stuff. Where we wanted to get out of that. So I'm still in the business, but I'm in it under a different umbrella, under a different shop. Okay, that's more under the social service agency, whereas serving lunch to people at the church is just simply serving lunch to people at the church.
Father Jay, I would encourage you and the others that are working in the ministry there to consider how can you engage folks in a way that's going to do more than just provide relief, but truly restoration. I think partnering with other organizations is great, but I also think that there are ways for every church and charity to exercise what I call challenge model ministry, where we are a little bit investigative about what's going on in a person's life. We want to get to know what's happening with them so we can better help them. Maybe we want to sit with them and help set some goals about the future and some things like that, or even require people to earn something that they need. And so in all of that, here challenge develops. And what we want to make sure is that we're all developing. You, me, the people that we're serving. We want everybody to develop. And if all we do is feed or clothe or what, we're gonna miss that, because aid doesn't really develop people. So we want to challenge people in some way.
And I will just say, there's a lot more to that, but I will say, for example, we also have those case managers come over for lunch, and that's when they begin to start to form those relationships with those other people and start to help the ones who may be helpable. Because some of the ones, and this is what I've always said to some of the folks who are going to say, well, some of those people should go and get a job. And I would say, well, if you come have lunch with us, maybe you'll understand that some of those folks may not even be employable. Now, that doesn't mean that they don't have their human dignity.
And it doesn't mean that they can't be challenged in some ways.
And that doesn't mean that they can't help with other things. It doesn't mean they can't wipe off a table and reach their dignity a different way.
Right.
But they're not going to be able to be challenged to the same level that some of the others would be able to be challenged to.
You're right.
The ones that can be challenged to their level, well, of course, if they're just there, then we form a relationship with them. They know that we love them. Then we can get to the point where we can start to say, what can we do? So we need to take a little break here, and this is Faith in Our Hometown.
You're watching Faith in Our Hometown on KSN TV, brought to you as a community service of Mercy Hospital, Joplin.
Welcome back to Faith in Our Hometown. I'm here with James Whitford, who's the Executive Director of Watered Gardens Gospel Rescue Mission, and we've been talking about how we reach out and try to serve the poor. And we both agreed that it's an act of faith for us, okay, which is a good thing. And we've talked a little bit about different philosophies, and you've talked a little bit about, again, how do we give everyone the opportunity to grow to the best of their human potential, which I agree with wholeheartedly, okay? And I do think that we need to put ourselves in those positions of being in those relationships with people. This is one of the things that sometimes I think the churches are better at than the government is. All right, and I'll just go on. I'll go out on a limb and say that. All right, but we're better at this sometimes than the government is because we can form the relationships in a little bit of a different way, and really do then gently challenge people to maybe live up to more of their potential. Some of those kinds of things. Let's talk a little bit about the role of government, though. What do we see the role of government is in taking care of the poor? Where do you come down on that?
Well, I think more importantly than talking about what the government ought to be doing in that regard is maybe what the government should not be doing initially in regard to helping the poor.
Okay.
So there is a social teaching, Catholic social teaching principle, subsidiarity,
right?
And it's that larger, more complex bureaucratic systems shouldn't be the first to respond to need, that it really should be actually not just immediate family, but it should be the person, him or herself, that we should recognize that there's an inherent capacity and potential in every individual to produce, to be able to do, to create, and maybe to help him or herself, and maybe even others around him or herself. So that's something that's very important that we should recognize in every person. But if that person's not able to do what they need to do, it should be immediate family. And that's something we practice at our mission all the time, Father Jay. We're making phone calls to family members and engaging them to help the people that they're closest to. So that would be respecting this principle of subsidiarity. After that, maybe local church. Local community, churches and charities helping individuals and families that are in need. And then, we could look at state and federal level help. So I think it's really important that we, respect this principle of subsidiarity.
Yeah, but I think sometimes we could also use that principle of subsidiarity if we interpret it too narrowly. Okay, because I agree with it, and let's face it, we came up with the principle.
Yes.
All right, but and I don't mean that just we Catholics, but we outlined it. But it's a good Christian principle.
It's good stuff.
Okay, it's good stuff. But by the very same token, I think that sometimes we also then forget what is the role of government, and the role of government is to make sure that if there are people who are falling through the cracks, that they also get care. Because part of the role of government is also to make sure that they care for the least among us. Government is really supposed to, in some ways, be modeling some of the best behavior that we should be having in the church.
Well, the government is by the people, so
right.
The people should be modeling,
right.
and not the government. So.
Well, and I agree with that, but I still think that, for example, let's just take food assistance in any way, shape, or form that happens in the United States. Okay.
Right.
If you took all of what the churches are able to do, that's only going to amount to about 10% of the dollars. Many of our Catholic service agencies would not be able to perform some of the duties that they perform and the care that they give if it were not for some of the government dollars coming in to provide for us to be able to take care of some of those things.
So there was some interesting research that was done by Hungerman and Gruber, and they looked at a crowd-out effect. When government really began getting more involved in helping the poor, there's a statistically proven crowd-out that occurred really in church giving. They looked specifically at church giving, and not just giving to their church, but giving into those particular social service sectors where the government was getting involved. And it showed that up to 50 cents on the dollar was being crowded out as the government was getting involved in that. So you and I can look right now and say, oh, the church and local community, private community could never do it all. But the truth is, if the government began to pull out and respect that principle of subsidiarity more, I think we'll see more local, private, community, and church involvement step up to the plate.
Well,
and our God's a big God. Who knows?
Maybe, but I think that's also the God of trickle down, and I'm a little suspicious. Okay, I'm just a little suspicious because I do not see Part of what the way I was raised by my parents was, that's part of the reason why you pay taxes.
Oh, right.
Okay?
Yeah.
I mean, really. Part of the reason you pay taxes is to take care of some of the people that would fall through the cracks.
Yeah, but Father Jay, the people that would adhere to that idea are probably going to be a little bit less, maybe, to get involved. Maybe not so with your parents, but I mean, certainly some that would say, hey, my tax dollars are going for that. I don't need to help him. When that happens, we won't get into the relationships that you've talked about and valued so much.
Well, that's why I respect so many of our volunteers. I mean, I really do, because some of them are, fairly conservative. They're very conservative politically. They don't want to pay more taxes than they have to, and I respect them for it. I mean, I respect the position. But by the very same token, I also respect the fact that they're actually in there volunteering, and they're actually walking the walk in addition to, where they're going to come down on the political spectrum. And I really have to give them tons of kudos for that, because they're doing both, okay? Right. And I think that so much of some of the backlash with government, the way people feel about the government, is because they'll hear about this story of waste or that story of waste or that story of waste, and that's where I think subsidiary really does come into play in a very real way.
Right.
I mean, because when we are in some of these relationships, I mean, and I'm not gonna lie to any of our listeners out there to say that I think that every charitable organization does what they're supposed to be doing, but how much on the dollar that I'm given? If I'm given $1 to spend for the outreach, I can pretty well guarantee you that that's coming, all that money's going for food.
Right.
All right? I can guarantee you that. I can guarantee you that most of that money's going for direct care. Whereas, I'll worry about the salary and all that stuff out of the regular collection basket and all some of that stuff. But if I get a donation for the outreach house, all that money we've been able to has gone for food and equipment and doing some of those kinds of things.
Sure.
That's a blessing. Okay? Yeah. So we're able to do some of those things. We can make those decisions at the local level, I think, better than the government can. But I also don't want the government to just step back from the whole thing and say, one of our roles is not to do this, because I really truly believe that one of the roles of the government is to help make sure that we are taking care of the most vulnerable in our society. Yeah. And again now, and I think we'll agree on that, but how we're going to get to it, we probably will have some disagreement, okay? And that's okay. But I just wouldn't want to lose. I do not want to let the government off the hook, because I think that one of the purposes of government, and always has been one of the purposes of government, is to make sure that we're protecting the most vulnerable in the society.
Yeah, for me, I think the primary purpose of the government is to allow for liberty, to foster freedom in our nation. And so I think, protection, so law and order, right? I think that's the primary function. And then, to allow liberty to play out means that some people might make bad decisions that result in great problems in their life. And it's not that we shouldn't help those individuals, but for those to really know, we're going to have to be close to know, was this a person that, it was a bad luck situation, or have they made a series of wrong decisions that have landed them there? And if there is a safety net that's robust enough that it just kind of catches people all the time from experiencing the repercussions of bad decisions, I know for a fact that not only will they, will that occur, but they won't realize that good decisions have an opposite effect. See, what happens is there's a trap that occurs there where people don't have freedom anymore. They're being caught from experiencing the repercussion of decisions, therefore they're not realizing that good decisions are going to make life better. And so I see people kind of in that all the time, and it's just, that's one of the problems that I see with government involvement in helping the poor. And all I'm saying is it ought to be you and me first. It ought to be our neighbors first. And when you have low-hanging fruit of, so there's food stamp reform now that's occurred in 2016. TANF, Temporary Assistance for Needy Family Reform, has occurred this year. And so some of that's very easily accessed. And what happens is, why should I develop a relationship with someone who eventually is going to challenge me to take a step in the right direction if I don't have to do that? And so I think, again, we see an interruption to some of the, what God would intend as natural relationships that should occur, really coming in solidarity with the poor in our own community. And I think we see a disruption in that because of state involvement.
What I would say is that I think I'm going to come down on a little bit of a softer underbelly here. Okay, I do know some of those people that fit that profile exactly that you just laid out.
Not all, but yeah,
exactly.
Right.
And I could not agree with you more that there are some people who are just flat out trying to take advantage. Okay.
Right.
And then there are some people who just don't even know how to step forward and do that without a whole lot of coaching.
True.
All right.
That's so true.
And I am big into the coaching. All right. Which is why I believe in what we're doing at Catholic Charities and case management and some of those kinds of things, because I've seen so many lives get turned around because people felt the dignity of earning a paycheck and maintaining their home and doing all those things. And when we made that possible, when we opened enough doors for them to do that, they're sailing now, and they're producing in a way that they've never been able to produce in their life because nobody even taught them how to do it in the first place. You know, when I look at my own life, I see my own parents and I go, oh, the lessons I learned, thanks be to God, you know, about working hard and that you shouldn't be afraid of it and all those things. But I also know that not everybody got taught those lessons. True. And I want to make sure that we're not losing any of those folks along the way, which I believe, and again, this is where we'll probably disagree a little bit, but I think the government plays a role in that, and I also think that the church and our organizations play a part in that. And I would agree with you that to some degree, I think the government bungles it once in a while, okay? Yeah. So you know, and I would say the church even bungles it once in a while. What the heck?
Maybe we can agree that just local community first, and then you see maybe state afterward.
Yeah, well, but I'm also saying that I think that without some of that other money, we're going to be in trouble, okay? So we are going to come back here in a moment, right after this Mercy Minute, where I will wrap things up for you in just a second, okay?
Hi, I'm Angie Separito with Mercy Hospital. I'm here today with Dr. Samir Dalia. Dr. Dalia, you are an oncologist and hematologist with Mercy, is that correct?
Yeah, it is.
Okay, and you are located in the Mercy Cancer Center. Can you tell me a little bit about hematology?
Yeah, so hematology is the study of blood, and we basically deal with disorders such as leukemias, lymphomas, blood clotting disorders such as if you had a blood clot in your leg, the hemophilias, sickle cell disease, and any other problem with the blood, including low platelets, high platelets, anemia, or a problem with your white blood cell count.
So you're located in the Mercy Cancer Center, and if a patient needed to be seen, wanted to come to the Mercy Cancer Center, do they need a referral?
They don't need a referral to see us.
Okay, so they could just simply call the number on your screen, or if you wanted to find out more information, you could actually visit mercy.net.
Good morning, and we're wrapping up Faith in Our Hometown for another week. My guest this week was James Woodford, who's the Executive Director of of Water Gardens Gospel Rescue Mission. We've been talking a little bit about the role of the government versus the role of the church and how we respond to issues of poverty. When we do that, of course, you know, James and I were laughing because we were saying, well, you know, did we have a little too much disagreement this morning? And I think it's good. I think it's good to have different philosophies in those things, and I think it's good for us to have a conversation about how we want to engage that, because I think that every once in a while the government should challenge the church a little bit, and the church should challenge the government a little bit. I think it's probably healthy for all of us. We do need to make sure that we're taking care of folks, and we're going to talk a lot more about that next week, actually, on our program. But for this week, this is Faith in Our Hometown. So please join us next week for another conversation. God bless.
Thanks for watching. Faith in Our Hometown can be seen every Sunday morning at 9 a.m. here on KSN. Brought to you as a community service by Mercy Hospital, Joplin.